And we are back with Cody Martin, a physician assistant with Cone Health Virtual Care. We're talking about practical recommendations and resources to help you take that first step to quit smoking. So let's talk about that, those resources, the tools that are available through Cone Health.
Yeah, so Cone Health has a lot of resources, which is fantastic. And for a concise list of all of those, you can go to conehealth.com/quit smoking. But for example, through our Cone Health Virtual Care, we offer a tobacco treatment program that you can do from the comfort of your home. It's Monday through Friday, 8 a.m. to 8 p.m. Um, there are our cone pharmacists have a lot of resources where they can connect patients with medication assistance for nicotine replacement therapies. Um, Cone has a lot of community health and wellness events where there's a lot of outreach in the community towards this. But I also recommend that patients reach out to their primary care provider, or if they have a specialist, those are fantastic tools. And I'm sure those doctors are likely already having those conversations with the patient, but they will be thrilled that you're bringing it up. So, yeah, there are a lot of resources, thankfully, for patients.
I love things that you can actually go out and do and things you can just do from your own home. So it's a little bit of everything for anybody, no matter what stage of life you're in. All right. If someone is worried about like the withdrawal symptoms, how they're going to feel the first couple of days, the first couple of weeks, what should they expect and how can you help them manage those?
Yeah, so oftentimes what people may experience are, increased frequency or more noticeable or significant cravings. Might feel a little bit irritable or restless, maybe some difficulty focusing, trouble sleeping, or potentially an increase in appetite or hunger with some potential weight gain. I think the best way to manage these again is to be informed. If you're aware, hey, these things are likely to happen, then you're better able to recognize them and act on it. For those cravings, we honestly will recommend to a patient to try to distract yourself. Usually a craving will last 3 minutes or so. So if you can find an activity to distract your mind for those 3 minutes, that craving will have passed. So listen to some music, or if you've been meaning to call someone, give them a call, go for a walk. Those are all things you can do. And then for a lot of the others, thankfully, there are medications that can be used. So things like nicotine replacement therapy, so patches, gums, lozenges, things that can help, mitigate some of those withdrawal symptoms while you're trying to quit. So thankfully, there are a lot of options for that.
What about for folks who, they're the loved one of someone that smokes. So they care about someone and that person is smoking and they're trying to help them support that they would quit. How can they help support them, not nag them, support them?
Yeah. So going on to that, yeah, I would say again, it's just being a support system, being a listening ear. It's not your job to solve that problem. They not wanting you to solve that problem, but just them knowing that you're in their corner. That really can go a long way. And even if you are someone that you have a loved one that's trying to quit smoking, and you yourself are a smoker, that's a great time to kind of assess, well, am I ready to do that? And if so, that's great. If not, though, trying to still support your significant other or this person in your life as best you can. So try not to smoke in front of them. Don't make your tobacco products easily accessible to them. Simple things like that. I mean, it really does make a huge difference.
Okay, we've got about a minute and a half or so. If someone really wants to learn more about how to quit smoking, reduce their nicotine dependence, who should they contact? Who do they start with?
Yeah, so I always recommend if you have a primary care provider, I would reach out to them first. They're going to know your health, the history the best, right? And they can oftentimes, help to directly address that problem. Or if they feel any other assistance is needed, then they can help even set you up, say with our tobacco treatment program. If you don't have a primary care provider currently, then again, going to conehealth.com/quit smoking, and you can see all of the local resources, including our program, that are there to help you. Even outside of Cone, again, there's smokefree.gov that has a lot of resources. And then each state has their own quit line. So there's a North Carolina quit line that you can actually call. Your primary care can even refer you there, but you can give them a call yourself and they will help to get you set up on this journey.
Okay, one quick final thought before we go about for someone who's like, I don't know, I've been trying and I haven't been successful.
Yeah, I would say, it's just taking one step at a time. Just because it hasn't been successful in the past, that does not mean it's going to be the case this time. It's a journey, so it's not going to be a straight line. It's going to be twists and turns and ups and downs, and that is okay. But it's reaching out to a provider that can help you. You guys can make those decisions together to make sure that this time is a success. And just
Gotcha.
don't give up on yourself.
Okay. Well, thank you so much for your time and your expertise. If this is something that you think somebody else needs to hear, needs to listen to, this is going to be posted on our website in the To Your Wellbeing section of our website. Right now, we're going to get a check on the forecast.